So now that we've talked about the experience of getting dentures and what that procedure is like, let's talk about what it was like getting dental implants, which is another option if you are having to get all of your teeth removed. Now, there are all kinds of different dental implants. I feel like, I'm not lying, I feel like I am learning about new dental implants like once a month or something like that. I'm always learning about something new. But there are all different kinds. What I have personally is called All on X, or All on 4, All on 6. I have 6 on top, 5 on the bottom, so I call it All on X. But they are permanently screwed into my jawbone. So what I have are screws, titanium screws that go up into my jawbone. And over time, 3 to 4 months is typically when it happens. That's why I'm on the soft food diet for 3 to 4 months. But your bone will osseointegrate with the dental implant, basically grow around it, and it will become a part of your body. Then this prosthetic, which is just an arch of teeth, there's nothing covering the roof of my mouth, anything like that. It goes up on a ledge right here. That arch of teeth screws into those implants. So they're in there, they're permanent. These usually last, they're supposed to last 20 years to a lifetime. Now, of course, and this is the question I get all the time is, are you worried about implant failure? It's definitely a risk, but like with any surgery, there are always risks. And implants in most studies have been over 90% successful. So that's huge, right? that's a huge percentage of a success rate. So if that's what's scaring you, please just know that it is rare. It does happen. I've had a lot of people tell me that it has happened to them, so it definitely does happen. But if you're going with a good dentist, they'll be prepared for that kind of thing and be able to help you. If you are going in for a dental implant consultation, that is something that you should bring up if you are worried about it. What if a dental implant fails? What's going to happen then? Are you going to be able to put another one in? Like, is that going to be covered? All those type of things. Those are things that you're going to want to talk about in your consultation. So when you go to get dental implants, the first thing that you're going to do is get a consultation. And I have a video, if you look under my implants playlist, you'll see the first video that I had a consultation with Jack's Dental Implants, who did my wonderful, beautiful teeth. Jack's Dental Implants in Jacksonville, Florida, and they are absolutely wonderful. Anyways, so you can see my consultation video, see exactly what it was like for me. Again, this may differ with different dentists on what that's going to look like for you. But for me in my consultation, we did all the scans to make sure that I was a candidate for dental implants. I met the doctors, talked with them, went over everything that I was looking for, how much it was going to cost, all those different things. They go over everything with you during that consultation. Then after your consultation, you're going to get booked for pre-op. And during that time, they will, I believe they took impressions in the pre-op. I have a pre-op video in that same folder if you want to look for it. I have the worst memory in the world, I'm not going to lie. But I believe they took impressions during that pre-op appointment. They also took measurements, all that good stuff to, get you all ready for surgery. Answer any questions that you have about surgery, address any concerns at that point, that kind of thing. So I had the consultation, the pre-op appointment, and then I went right into surgery. I had like a month in between that time because my kids were in summer school and stuff, but not summer school, excuse me, summer camps. But anyways, you can usually schedule it as long as they are open pretty quickly after that pre-op appointment. So you go in for surgery. What it was like for me was I had early in the morning. They got me in, like took blood work, all that kind of stuff. I took the oral conscious sedation, Halcyon, and started feeling it probably like 30 minutes after taking it. And then they went straight into surgery, and I don't really remember much of anything. Sedation is kind of different between dentists, so that is another thing you're going to want to talk about if you're getting dental implants is, am I going to be sedated? What is it going to be like? Are you going to offer IV sedation, hospital sedation, the oral conscious sedation? Talk about, what exactly that's going to be like and what they offer. Some people are not comfortable with the oral conscious sedation. I was super nervous about having it done beforehand, but it was so easy. It was great. I would do it again, definitely. But if you're not okay with that, you could talk about your options with IV sedation and stuff like that. So I had the surgery. went home in my temps that day, or went to the hotel in the temps that day. And yeah, it was great after that. There was about a week of like really intense pain, I'm not gonna lie. And I've heard from other people that they had no pain at all. So I think it really is up to you, your personal pain tolerance. I have chronic pain and chronic issues. And like I said, sensory processing disorder. So I don't deal with acute pain very well at all. No. I'm also the type of person where if I get like an IV or like a blood work or stuff, I faint immediately. Just can't handle it. But for some people, I've heard that they had no pain. Some people have pain. It's just, you know, it's going to be up to your body on how it's going to feel for you. But the pain lasted about, like I said, intensely for a week. And then it kind of lingered around until the 2-week mark. And then 2 weeks into it, I felt amazing. Felt very strong. I'm a month into it now, and I am absolutely beyond satisfied with how they came out. The way that they look so natural. They feel so strong. Like I said, I'm still on a soft food diet, so I can't really give you guys an accurate description of how strong they are when it comes to chewing, because I can't eat anything hard. But I will definitely let you guys know, you know, once I've been able to test out that theory. But they feel very, very strong. And the final material that, okay, so let's talk about temps and finals too. So we talked about that with dentures. You can also have that with dental implants. These are temporaries. So they're made out of a completely different material than what my finals will be made out of. My finals will be made out of titanium and zirconia. So they are pretty much indestructible, virtually indestructible. Someone told me that you could eat like crab legs with them, like just. So yeah, they are very, very strong. This tip material is not as strong. I don't know if you guys saw Faith Hill's video, but you can see what can happen to Tims. They can break. They're not made of the strongest material, but they're just there to, you know, while you're healing, keep everything in place like it's supposed to, and, you know, give you teeth while you're healing, because you're gonna have to heal for, like I said, about 3 to 4 months is typically when that osseointegration happens, and then you can be put into your finals. And that is how the dental implant procedure goes, or at least it's how it's gone in my experience. Like I said, there are all kinds of different dental implants. There's snap-in dentures, there's 3-on-6, there's individual dental implants, there are all kinds, different kinds. So just research and explore your options to figure out what is best for you. Definitely look at what the time frame is between like how long they last, because that like snap-in dentures and what I have definitely have a different time frame on how long they last, but they also have a completely different price range too. So go over all of your options, figure out what is best for you and what you can do. And also, if you're researching into dental implants and you see how expensive they are, please also know that a lot of places do payment plans. It's very similar to like if you're buying a car, you're not going to pay all of that all at once. You're going to make payments on it. So just explore your options with payments, lenders, different dentists, all those type of things. Make sure you look at their before and afters and make a decision that's best for you. If that's what you can afford, what you want to go with, then yeah, it's the best decision in my opinion. But that is the difference in procedures between getting dentures and dental implants, at least in my personal experience. Again, I'm not a dentist or a professional, anything like that. I'm just a person who went through getting dentures and getting dental implants. So I can give you guys both sides of it. I hope this video helped you make a more informed decision, and yeah, follow me if you want more.